Ladies and gentlemen, after 60, most men are told directly or indirectly that their sexual desire has an expiration date. Society paints aging as a slow dimming of passion, a quiet surrender to physical decline. But that's not the truth. The truth is that desire doesn't retire, it evolves. The body changes, yes. Testosterone levels may drop, the skin may become thinner, and erections may not come as easily as they once did. Yet, beneath those surface changes, the core of male sexuality, the longing for connection, pleasure, and vitality remains fully alive. What shifts is not the existence of desire, but the way it expresses itself. For men over 60, pleasure becomes less about proving power and more about understanding rhythm, awareness, and emotion. At younger ages, sexual energy is often driven by urgency, a kind of physical demand that seeks quick satisfaction. But with age, something far more refined takes shape. The experience becomes slower, deeper, and more mindful. You begin to understand that your body no longer responds best to haste. It responds to care. Masturbation after 60 isn't about replicating your 20s, it's about learning your 60s. It's about listening to what your body wants now, not what it used to crave decades ago. It's about realizing that the power of your sexuality has never been in youth itself, but in presence. When you allow yourself to reconnect with your body at this stage of life, you rediscover sensations that may have been lost in the noise of busyness, responsibility, and fear of aging. Every touch becomes intentional. Every breath becomes part of the experience. You start noticing how arousal builds differently now, perhaps slower, but more meaningful. You learn that pleasure isn't about intensity, it's about sensitivity. And when you stop rushing, your body rewards you with awareness that feels fuller and more complete than before. Many men struggle to accept this transformation because they measure their vitality by comparison. They compare their present performance to their younger selves, and when it's not the same, they interpret it as loss. But it's not loss, it's evolution. The body doesn't betray you when it slows down. It invites you to experience a different kind of pleasure, one rooted in understanding rather than urgency. That shift from performance to presence is not a downgrade, it's a gift. It allows you to experience intimacy with yourself in a way that feels emotionally grounded and physically safe. The mind also plays a major role here. At 60 and beyond, self-perception can either enhance or destroy desire. If you see aging as decline, your body will mirror that belief. But if you see it as transformation, you'll find strength in every touch. Your brain is the most powerful sexual organ you have. It governs arousal, release, and satisfaction. When you approach masturbation with guilt, your mind creates stress. Your body responds with tension. But when you approach it with curiosity and kindness, your body relaxes and responds. You become not just a participant in pleasure, but its creator. And there's something profoundly beautiful about that. Masturbation becomes less about stimulation and more about intimacy with yourself. You begin to appreciate the body that has carried you through decades of life, through challenges, triumphs, and change. You see the wrinkles not as flaws, but as evidence of a story still being written. You realize that sexual pleasure isn't a reward for youth. It's a right that exists as long as you breathe. That understanding gives you confidence that no pill or performance trick ever could. It's also important to remember that this stage of life can be deeply freeing. You're no longer shaped by the insecurities of youth or the pressure to prove yourself. You've earned the right to take your time, to explore, to understand what feels right today. There's no race, no goal, no scoreboard, just you, your body, and the quiet knowledge that pleasure still belongs to you. When you touch yourself now, you're not chasing something, you're connecting with something. That connection, that calmness, is what makes this phase of sexual life so profoundly rewarding. So yes, your desire has evolved. It may look different, feel different, and unfold differently, but it's still yours. It's wiser now, less about urgency, and more about intimacy. It's no longer about proving you can. It's about feeling that you still want to. You've learned that strength doesn't come from force, but from awareness. That's the true lesson of aging sexually with confidence, understanding that the body changes, but the flame within it does not go out. It simply burns with a different kind of light, steady, deep, and endlessly human. As men age, their relationship with their own body begins to shift in ways that are subtle, yet profound. The skin that once stretched and responded easily to pressure becomes thinner and more sensitive. The veins and tissues that once tolerated friction with no consequence now require gentleness and care. It's not weakness, it's wisdom written into the body. The phrase, friction is the enemy, gentle is the new strong, captures this truth perfectly. What many older men fail to realize is that pleasure after 60 depends not on intensity, but on sensitivity. The days of rough stimulation and hurried release are gone. What replaces them is a slower, more aware connection to touch and response. At 60 and beyond, the skin of the penis loses some elasticity and natural lubrication decreases, which means that what once felt normal can now lead to irritation, dryness, or microtears. These small injuries might not seem serious, but over time, they can cause discomfort, sensitivity loss, and even infection. That's why lubrication becomes your best ally. Using a water-based or silicone-based lubricant reduces friction, prevents irritation, and allows the experience to feel smoother, more fluid, and more natural. It's not an accessory, it's a form of self-care. It's what keeps the act of self-pleasure safe and satisfying. Gentleness, too, is not about being fragile, it's about being in tune. When you touch yourself with intention and patience, your body responds differently. You start to notice smaller sensations that you might have ignored in the past. The warmth of your skin, the pulse of blood, the gradual awakening of sensitivity. These details are where true pleasure lives. Rushing through them only means missing them. Masturbation, when done gently, becomes an exploration rather than a performance. You begin to rediscover your body in a quieter, more intelligent way. It's also worth remembering that as you age, blood flow to the genitals may not be as strong as before. That means the tissue can become more vulnerable to pressure and strain. Aggressive or prolonged sessions might not only cause discomfort, but can also lead to mild bruising or vascular strain. This doesn't mean you should stop, it means you should adapt. Use your hands more softly. Focus on rhythm rather than force. Allow arousal to build naturally instead of chasing it. The slower you go, the deeper your body can respond. There's another truth here that many men overlook. The mind amplifies sensation when the body feels safe. When you are gentle, your nervous system relaxes. When you're harsh, your body tenses up and the pleasure fades faster. The balance between physical comfort and psychological relaxation is what makes sexual pleasure so powerful at this stage of life. The moment you stop seeing gentleness as a sign of weakness, you open yourself to a far richer experience of masculinity. And let's talk honestly about ego. For decades, men have been told that sexual energy is about strength, speed, and stamina. But that old definition of manhood doesn't serve you anymore. Strength now means control, patience, and respect for your body's limits. When you slow down and treat your body with care, you're not giving up power, you're reclaiming it. You're showing that you understand your body's new language. You're no longer fighting against time, you're moving with it. Gentleness also prevents one of the most common issues older men face, irritation or burning after masturbation. These sensations often come from too much pressure or dry friction. By taking time to prepare, using lubricant, and staying mindful of how your body feels, you avoid that discomfort completely. You protect the skin, the nerves, and the confidence that come with a satisfying release. Because what truly matters isn't how quickly you reach climax, but how connected you feel when you do. And when you do finish, the recovery phase is also different now. The body may take longer to return to normal sensitivity, and that's perfectly fine. Allowing rest between sessions, staying hydrated, and keeping clean afterward are simple yet powerful ways to maintain health. These little acts of care remind your body that pleasure isn't punishment, it's nourishment. So, when you hear the words, be gentle, understand that it's not about losing passion, it's about transforming it. It's about moving from friction to flow, from pressure to presence. At this stage of life, your body has earned a softer kind of touch. It deserves respect. It deserves awareness. And when you give it that, you'll find that pleasure not only returns, it deepens. Because true strength at 60 isn't about how hard you can go. It's about how deeply you can feel. Pain is one of the body's oldest and most reliable forms of communication. It doesn't exist to punish or embarrass. It exists to protect. Yet for many men, especially those over 60, pain during or after masturbation is often ignored, dismissed, or misunderstood. They see it as a test of endurance, something to be conquered rather than respected. But the truth is simple and profound. Pain is not a challenge, it's a messenger. It's the body's way of whispering, something needs attention. When you listen to that message instead of fighting it, you give yourself the chance to experience pleasure safely, to maintain your sexual health, and to preserve the confidence that makes intimacy meaningful at any age. As men age, the nerves, blood vessels, and skin of the genital area become more delicate. Years of use, changes in hormones, and reduced circulation can make these tissues more sensitive to irritation. What was once a harmless level of pressure or repetition can now cause soreness, bruising, or even small injuries. The problem is that many men interpret these sensations through the lens of their youth. They remember what their body could handle 20 or 30 years ago, and they try to repeat it. But the 60-year-old body has a different. When it sends pain signals, it's not saying push harder, it's saying slow down. Ignoring pain doesn't make you strong, it makes you vulnerable. Repeated irritation or discomfort can lead to long-term sensitivity loss, minor inflammation, or nerve irritation that can dull pleasure over time. Some men experience tingling or numbness afterward, which is their body's way of signaling nerve fatigue. These symptoms should never be taken lightly. Listening early prevents more serious complications later. Pain, in this sense, is your teacher. It's showing you where balance and awareness are missing. It's also important to understand the emotional dimension of pain. When a man feels discomfort during self-pleasure, shame often follows. He may think, something must be wrong with me, or I'm losing my manhood. But this thinking only creates tension, and tension amplifies pain. The truth is, you're not losing anything, you're learning. Pain is an invitation to understand your body's limits, to adapt your approach, and to replace frustration with mindfulness. When you shift from fear to curiosity, when you ask, what is my body trying to tell me? You turn pain from an obstacle into guidance. For example, some men may notice pain because of dryness or lack of lubrication. Others might experience it due to prolonged stimulation without rest, or from maintaining an unnatural position for too long. These are not signs of disease. They're signs that your body is asking for care. Gentle movement, proper lubrication, and shorter sessions can make a tremendous difference. It's about quality, not quantity. Pleasure should leave you feeling relaxed, not sore. The body's comfort level is not fixed. It changes daily depending on sleep, hydration, mood, and overall health. Paying attention to those small variations is part of the art of safe self-pleasure. Pain can also be a warning sign of something deeper. If you notice sharp, consistent pain in the penis, testicles, or lower abdomen, it could signal an underlying issue like an infection, inflammation, or circulation problem. Ignoring it and continuing sexual activity only increases the risk of worsening the condition. Seeking help from a urologist is not a sign of weakness, it's a sign of self-respect. Medical evaluation can identify problems early, and most are easily treatable when addressed promptly. The real danger lies in silence. Too many men suffer in quiet discomfort because they believe sexual pain is an inevitable part of aging. It isn't. It's a signal, and signals are meant to be read. One of the most powerful changes that happens after 60 is the growing connection between awareness and pleasure. When you listen to your body, when you respect its limits, something beautiful happens. You become more in tune with every sensation. Pleasure no longer comes from force. It comes from flow. There's a calmness in learning to stop when it hurts, to adjust your rhythm, to breathe and start again. That awareness doesn't diminish masculinity, it strengthens it. It replaces anxiety with confidence and transforms self-pleasure into self-care. Pain is not your enemy. It's the language of a body that still wants to function well, still wants to feel alive, still wants to be respected. The next time you feel discomfort, don't fight it. Listen, change your approach. Give your body what it's asking for: patience, gentleness, time, because every man, no matter his age, deserves pleasure that feels safe, satisfying, and free from fear. Listening to pain isn't surrender, it's mastery. It's how you stay connected to your body and continue to enjoy what life has given you the enduring capacity to feel. The prostate is one of the most important yet most overlooked parts of a man's body. It sits quietly beneath the bladder, small and unassuming, but it plays a powerful role in sexual health, urinary control, and overall well-being. After the age of 60, the prostate begins to change. Hormonal shifts, inflammation, or natural enlargement can make it more sensitive and more prone to discomfort. For that reason, how you treat your body, even in private moments, can have a direct effect on your prostate's long-term health. The truth is, your prostate depends on you. Masturbation, when done safely and regularly, can help maintain circulation and function, but when ignored or performed carelessly, it can cause unnecessary strain. Every time you ejaculate, your prostate is engaged. It contracts and releases fluids that are part of semen, helping to keep its internal ducts open and healthy. This process helps prevent congestion, a condition where fluid builds up and causes pressure or discomfort. For older men, gentle and regular sexual activity, including masturbation, can help reduce this risk. It's not about frequency or performance, it's about rhythm. When ejaculation happens naturally, the prostate stays active, which supports blood flow and reduces the likelihood of inflammation. It's a natural way to keep things moving, just like stretching helps keep your joints flexible. However, the balance is delicate. If masturbation becomes too frequent, aggressive, or painful, it can irritate the surrounding tissues. Men sometimes mistake mild pelvic or lower back discomfort as simple muscle strain, but it can actually be the prostate sending early signals of fatigue or inflammation. Pushing through that pain doesn't make you stronger, it makes recovery harder. The body is asking for moderation, not abstinence. The goal isn't to stop, but to stay aware. There are also certain warning signs every man should recognize. Pain during ejaculation, discomfort in the lower pelvis, difficulty urinating, or blood in semen are not normal effects of aging, they are red flags. They may point to prostatitis, which is inflammation or infection of the prostate. It can cause deep aches, burning sensations, or even flu-like symptoms. The good news is, it's treatable, especially when caught early. But many men delay seeking help out of embarrassment, hoping the issue will fade on its own. That delay can turn a small problem into a chronic one. Taking action early by visiting a urologist is the smartest and most masculine thing you can do for yourself. Beyond infection, prostate enlargement is another common condition after 60. It's not always dangerous, but it can affect your ability to urinate or ejaculate comfortably. Masturbation, when gentle, can help ease some of the tension caused by this condition. But when performed with too much pressure, it can increase irritation. Using proper lubrication and avoiding prolonged sessions is vital. Think of your prostate as a muscle that responds best to steady, careful exercise, not strain. If you feel a dull ache afterward, take a break for a few days. Let the body rest and reset. It's also worth noting that general lifestyle plays a major role in prostate health. What you eat, how much water you drink, and how active you are all influence this small gland. Diets rich in leafy greens, berries, tomatoes, and omega-3 fatty acids can support prostate function. Staying hydrated keeps the urinary system clear and reduces inflammation. Regular movement, even light walking, improves circulation to the pelvic region. These simple habits work together with safe sexual activity to maintain a healthy balance. Some men worry that reduced sexual activity might harm their prostate, while others fear that too much might wear it out. The truth lies in the middle. Your prostate thrives on balance. It benefits from being active, but it also needs rest. A few times a week, in moderation, is often enough. Listen to your body. If it feels strained, slow down. If it feels healthy and relaxed afterward, that's a sign you're in sync with it. A most empowering thing you can do for your prostate is to stay informed and unashamed. Don't ignore changes in sensation or dismiss discomfort as just getting older. Your body always tells you when something isn't right, you just have to listen. Seeking medical help when needed doesn't make you fragile, it makes you wise. It's a declaration that your health matters more than your pride. Your prostate is a silent guardian of your vitality. It deserves the same attention you give your heart, your blood pressure, or your diet. It responds best to care, patience, and awareness. Every moment you take to understand it, to protect it, is an investment in your future comfort and confidence. Because after 60, real strength comes not from pushing harder, but from caring deeper. At 60 and beyond, a man's health becomes a delicate balance of body chemistry, medication, and lifestyle. Every pill taken for the heart, blood pressure, or diabetes doesn't just affect one, organ, it affects the entire system, including sexual health. This is why the connection between medication, mind, and manhood is so important to understand. It's a relationship few men talk about, yet it influences everything from desire to performance to satisfaction. When your body changes, your hormones adjust, and medication enters the picture, your sexual response naturally evolves. Recognizing this shift doesn't mean giving up, it means adapting with wisdom. Your masculinity isn't defined by how it used to work, but by how you take care of it now. Many of the most common medications used after 60, especially those for high blood pressure, diabetes, and cholesterol, can interfere with sexual function. They can lower blood flow to the penis, reduce sensitivity, or affect the nervous system's ability to trigger arousal. Even antidepressants or anxiety medications can alter desire or delay ejaculation. This doesn't mean you should stop taking them. These medicines often protect your life, but it does mean you need to understand their side effects and talk openly with your doctor. A urologist or primary care physician can often adjust dosages or recommend alternatives that have fewer sexual side effects. The goal is balance, not sacrifice. Ignoring the connection between your medication and your sexual health can lead to unnecessary frustration and misunderstanding. Too often, men blame themselves. They believe their lack of response means they're getting old or losing their masculinity. But that's not always the case. Sometimes, it's simply chemistry. Your mind might still want intimacy, but your body may be reacting to changes in blood flow or nerve sensitivity caused by medication. Knowing this helps shift the perspective from shame to awareness. It gives you control back, because understanding the reason behind a change makes it easier to address it. Your mind also plays a powerful role here. The brain is the control center for sexual function. Stress, anxiety, guilt, and overthinking can block arousal faster than any physical issue. When you add medication that alters mood or blood flow, the effects combine. This is why emotional health must be treated as carefully as physical health. Masturbation, in this sense, can be a tool for awareness. It helps you learn how your body responds now, what feels different, and how to adapt to that difference. It's not about chasing old sensations, it's about discovering new ones. Your nervous system can relearn pleasure through gentle exploration, patience, and focus. Communication is another form of medicine. Too many men carry silent worry about their sexual changes because they fear embarrassment, but silence isolates you. A simple conversation with your doctor can open doors to solutions, from natural remedies and supplements to medical adjustments or lifestyle changes. Modern medicine offers many ways to support sexual health safely. There are options for improving blood flow, stabilizing hormones, or increasing desire without risking your heart or health. But you'll never find them if you don't speak up. Your doctor isn't judging you. They're trained to help you live fully, in every sense of the word. The mind-body connection becomes even stronger as you age. If you believe your manhood is fading, your body responds with withdrawal. But if you believe it's evolving, your body adapts and strengthens. That's why emotional acceptance is so vital. Don't compare yourself to who you were 20 or 30 years ago. That man had a different body, different hormones, different worries. The man you are now has wisdom, awareness, and the power to make choices that serve you better. Your sexuality hasn't disappeared, it's simply matured. Even small daily habits influence this connection. Regular exercise, good sleep, and hydration can improve circulation and help your medications work more effectively. Cutting back on alcohol, smoking, or heavy meals can also make a noticeable difference in sexual energy. These changes are not about denial, they're about creating the best possible environment for your body to respond naturally. When your body feels supported, your confidence grows, and that confidence directly feeds your sexual vitality. Remember, your manhood isn't measured by performance alone. It's defined by how deeply you know yourself, how well you understand your body, and how responsibly you take care of it. Every man after 60 deserves the chance to feel pleasure, connection, and satisfaction, but it takes awareness to keep that balance alive. When you align your medication, your mindset, and your sense of masculinity, something powerful happens. You stop fighting your body and start working with it. You realize that your strength has never been about resistance. It has always been about understanding. And in that understanding, you find freedom. At the age of 60 and beyond, Men often face a quiet but deeply personal dilemma: how to continue embracing their own sexuality safely and confidently. The sixth and final truth is simple yet often neglected. Mental and emotional well-being are just as important as physical technique or safety. After 60, masturbation should not be viewed as shameful or risky, but as an act of self-care, relaxation, and emotional balance. Too often, men associate aging with decline, loss of virility, or fading masculinity. This mindset quietly eats away at confidence and self-esteem. In reality, masturbation at this stage of life can help men reconnect with their bodies and emotions in a positive way, provided it's done with awareness and balance. When a man takes time to understand his body's limits, respects its signals, and allows himself to feel pleasure without guilt, something profound happens. Stress decreases, sleep improves, and even cardiovascular health benefits from the release of tension. Science continues to show that moderate sexual activity, including self-stimulation, releases dopamine, oxytocin, and endorphins, chemicals that help reduce anxiety and depression. For many older men, loneliness becomes a silent struggle. Masturbation, when viewed as a healthy act rather than a taboo, can bring back a sense of connection with oneself that often gets lost amid health issues or life transitions. But there's another side that needs honesty: emotional isolation. Many older men carry shame around sexual expression. They were raised in times when discussing such things was forbidden, where pleasure was considered inappropriate beyond a certain age. This repression leads to unnecessary anxiety and secrecy, which can create physical problems like tension, erectile issues, and even insomnia. By allowing themselves to talk about it, whether with a trusted partner, doctor, or therapist, men can break free from outdated beliefs that limit their well-being. Emotional openness is part of sexual health. If a man finds himself feeling guilt, sadness, or confusion after masturbation, that's not something to ignore. It's a sign that emotional healing is needed. The body and mind are deeply connected, especially in sexual health. The act of self-pleasure should never feel like an escape from emotional pain, but rather a mindful connection with oneself. Taking deep breaths, setting a calm environment, and being present during the process are not just romantic gestures, they are health practices. They signal the brain to relax, the heart to slow, and the muscles to release tension. Another crucial part of emotional safety is knowing when masturbation becomes a replacement for real connection. Some men, especially those who live alone or have lost a partner, may unconsciously use it as a substitute for intimacy or emotional comfort. Over time, that can create a pattern of dependency that increases loneliness instead of relieving it. Recognizing this pattern and seeking new ways to connect through friendships, hobbies, or even volunteer work helps maintain emotional balance. Mental health and physical health go hand in hand. The more emotionally stable and relaxed a man feels, the healthier his prostate, blood pressure, and hormone levels are likely to be. Emotional stress can raise cortisol, which affects testosterone and overall sexual performance. On the other hand, a calm, confident mind supports better circulation and natural arousal. In this sense, masturbation becomes not just a release, but a reflection of mental harmony. It's also important to acknowledge that emotions may shift with time. What once brought excitement may now bring comfort, and that's completely natural. The goal after 60 is not to chase what was lost, but to embrace what remains meaningful. Sexual pleasure becomes more about peace than intensity, more about connection than climax. And that's a beautiful transformation, a mature form of scanned self-love that aligns with wisdom rather than youth. If anxiety, guilt, or physical pain ever overshadows the experience, that's the moment to reach out for support. A doctor, urologist, or even a sexual health therapist can provide reassurance and practical guidance. But the first step is understanding that pleasure is not the enemy of age, it's part of healthy living. Emotional well-being is the foundation of safe and satisfying self-care, and by nurturing it, every man after 60 can continue to feel vital, respected, and alive in his own skin.